they undergo an operation.
Okay, that is apparently the reason why the anesthetist normally have pre-surgery discussions,
yes.
appointments,
yes.
appointments, because you had with me.
Yes.
Okay, so in that discussion you try to know
how healthy you are.
Yes, exactly.
Yes. So
tell us a little bit about that.
So what we normally do is, if the surgeon decides that somebody has to undergo an operation, first thing we do is we give a sort of questionnaire to the patient. That questionnaire is very, it's full of questions about health, about daily routine, about weight, about medication, about diseases of the family, about everything.
Yeah.
And first, the patient has to fill in this questionnaire. Then he comes back to the hospital and he sees the anesthesiologist.
Yeah.
And then the anesthesiologist looks at the questionnaire and starts discussing points that are interesting, that may be potentially dangerous for the anesthetic. So if the anesthesiologist sees that the patients are using certain kind of medication, if the anesthesiologist sees that the patient has problems with her or his heart, or with her lungs, or with I don't know, is not able to eat properly. Those things. Then we have to see what we have to do with the patient before he actually can undergo the operation.
But you know, Dr. Gehlich, in the third world country, I really don't think that they take all of these things into procedure, like making first appointment, second appointment with the patient, and then discussing all of these long lists that you gave, your hospital gave to me when I had operation. Because you know why I'm very curious about this, or why I have been doing everything to bring you to this radio program, is that I believe many people may have had some difficult times. Like my family had a difficult time with our first daughter, who the husband rushed her to the hospital because we heard that she had fibroid and it was troubling her, and then the husband rushed her to the next the hospital. This was a private hospital, and then the next thing we heard was that she could not wake up during the operation. That's how we lost our first daughter. Wow. So today, my father and we are still grieving about her because she was just about 53 or 57 years old. Then she just passed away this way.
It is.
And unfortunately, when we pressed that we needed to know this hospital and we needed to discuss with this doctor, the husband refused till date. We don't even know the hospital where our senior sister died.
Well,
you see? So when I was about to have operation, the fear came. My whole family was almost afraid, because the first daughter died through that procedure. So I believe if the doctor had taken time to ask all of these questions to this woman, she wouldn't have died in the theater or this, because, I mean, fibroid, I don't know how fibroid can kill somebody.
Well, it's always a difficult thing to judge about cases that happen elsewhere. And where you don't know the two sides and where you don't know much about, but there is surely a difference, or can be a difference, between emergency operations and planned operations.
Okay.
Planned operations is any operation that is planned for a fixed date. So the surgeon makes an appointment with you, and he says, okay, you will be operated on the 15th of September, for example. That's also how your own operation went, I think. And if something happened to a patient, that, for example, a car accident, and the patient is unconscious, and he has to undergo surgery with the pre-existing unconsciousness. So in hospital there may be no family, maybe no relatives, maybe no passport from the patient. So then it's more dangerous, because nobody knows anything about such an emergency case. We just see a patient then. We see, okay, it's a male patient, maybe 80 kilograms or so, and then we have to go and give him anesthesia. But maybe he has serious condition that we're not aware of because nobody's able to talk to the patient before. And maybe he has a disease of his heart, of his lungs, that nobody knows. But there is no time then in such situation to wait till we have all the information, because then the operation would probably be too late for the patient.
Yeah.
So it's surely a difference between an emergency case and a planned operation. But what we normally see are planned operations.
Well, listeners out there, in case you are just tuning in right now, we are transmitting on 105.2 MHz ether and 103.8 cable. This is your popular radio station, Radio Voice of Niger. Today we are discussing on how safe is anesthesia, and we have as our guest Dr. Gehlich, who is an anesthesiologist from Amstelland Ziekenhuis. All right. So, Dr. Gehlich, how safe is anesthesia of this modern time?
I think nowadays anesthesia it's really a safe procedure. We try to evaluate patients before anesthesia, before operations, so that we know everything that's important for us.
Yeah.
And we also try to give the patients a choice in the technique of anesthesia as far as possible.
Okay.
There are some operations, I will give an example, an operation on your leg or on your feet.
Yeah.
There you can choose between partial anesthesia, where you stay awake during anesthesia,
Yeah.
or you can choose for total anesthesia,
Okay.
where you are in a sort of artificial sleep
Yeah.
in the time of the operation.
Okay.
As long as somebody has no medical reason to choose for one or the other technique,
Yeah.
we will let the patient do the decision what is more comfortable for the patient. And if we think both techniques are safe
Yeah.
for the patient, it's a bit what does the patient feel, what's more comfortable. One of our aims is really to make patients comfortable and to let them feel that they have the right to decide about their own body.
Okay. Which is all right. Which is very, very okay. Okay. So what can the patient do to make anesthesia safe?
Sorry,
What can the patient do to make anesthesia safe?
Well, in first place, it's really important that the patient tells the truth. And that's
about their health condition.
About the health condition, and that's not already always easy for everybody. One of two of the questions, but for example, in the questionnaire is how many cigarettes are you smoking per day?
Okay, that's for those who smoke.
Some patients are not daring to say the truth about that. So some patients say, well, I don't smoke, but they really smoke 30 per day or 40, so that's really different.
Okay.
Or some other people are afraid to give the actual body weight. So if we ask for the body weight, some patients will tell us, okay, I'm just 60 kilograms, but he or she is 90 kilograms. So that really makes a difference. And that's because, the first thing the patient can do is be honest with us, tell the truth.
Okay.
And
then how about if they do not have idea of how much they weigh?
Well,
you should have those things.
With a scale in the room next to me where it is, so that's not a problem.